So, Josh, maybe share like, okay, you're prepping to meet with a family to talk about code status. Like, what do you do? What's your, what's the approach? What sort of things? Like, how do you phrase
Yeah.
it for families?
Yeah. So first I figure out if they've ever had the conversation before. And if like a med student was in the room before me and I know they just had the conversation, I know I may have to walk some things back.
Jay walked out saying, "I'm a hero.
Yeah.
I'm gonna
Yeah,
do it all."
exactly. Yeah. Yeah. Generally I'll walk in. I will talk to the family about other things first. I don't usually walk in and say, "Hey, I'm Josh. Do you want CPR?" I'll figure out where things are at. And I will tell you, I have these conversations with someone coming in with a cough. They're completely well. And I have these conversations with people who are like borderline going to the intensive care unit. So I'll build a little rapport, and then I'll set them up. I'll say, "Hey guys, like I got to talk to you about a pretty hard subject that you may or may not have heard before." And I say, "Have you guys ever talked about things like CPR, life support, intensive care, or have the word DNR come up in your life?" And I will ask them and let them kind of tell me. Most people, I will say these days, who come into the hospital have heard it in some way. And I mean, I'll kind of say, "Hey, has there been decisions made before?" If it's a yes or no, then conversation is done. If they have it written down somewhere, even better. We know what everyone wants. But then I'll go into the specifics and I'll talk about CPR and I'll talk about how it can save a life. It can keep a heart going, but it doesn't often fix the underlying issue. It can break ribs. It's very traumatic. And depending where you are in your age and medical journey, the chances of survival are 0% all the way up to, I don't know, 25, 30%. I won't throw percentages in there too much. Then I'll talk about life support machines. If you go on that, there's a lot of medications, there's trauma to the airways potentially. And depending how sick you are and what you have, coming off those machines might be really, really hard. And you might not ever be able to come off.
Mhm.
Again, someone who's younger and healthier, I'm not going to phrase it that way necessarily. So I will be gauging my audience and I will be using my experience to say, this probably is a good idea for you because it may work if that's what you wanted. Or in some people these days, I'm so comfortable saying, don't do this. It is
Mhm.
not going to work. Just like if you don't have diabetes, I'm not giving you insulin. If you are 90 with cancer all over your body, do not do CPR or life support because it's not fixing the cancer, which is ultimately leading to all that.